You know, when you're building something that's meant to last for generations, you don't just start throwing up walls. You start with a solid foundation, a really detailed blueprint. And that's exactly what we're looking at today, the blueprint for Malaysia's health system. This isn't just about patching up a few cracks. It's about building a whole new structure that's stronger, smarter, and truly ready for whatever comes next.
So let's just think about that for a second. What really holds a massive nationwide health system together? Your first thought might be doctors, hospitals, medicines, and yeah, of course, those are vital. But what about the structure underneath it all? The rules, the leadership, the actual design of the whole thing? That's where the real strength or weakness is found.
And this right here is the game-changing idea. The whole goal is shifting. The health white paper for Malaysia isn't just a plan to treat sickness better. It's a vision for a system that actively promotes health and well-being. And the foundation for this whole vision? It's all laid out in Pillar 4, which is all about strengthening the system's governance. It's the detailed architectural plan for everything else.
Okay, so let's start right at the top with the architect and the plan. The very first part of this blueprint involves a fundamental rethink of who does what. We're talking about redesigning the leadership role of the Ministry of Health and beefing up the rules that govern the entire system. Now, this is probably one of the biggest changes in the whole proposal. Think about it. For decades, the Ministry of Health, the MOH, has been a player on the field. It provides the care, it pays for the care, and it makes the rules. The new blueprint says, hold on, that's too many jobs for one entity. So the MOH is being asked to step back and become the referee, focusing on making sure the game is played fairly and effectively. And this chart just lays it out perfectly. On the left, you see the old MOH, hands-on, doing everything, managing the day-to-day. Now, look to the right. That's the future, a strategic role. It's about steering the ship, not rowing the boat. And the reason for this is huge. It creates better checks and balances, it makes the system more accountable, and it's designed to drive up the quality of care for everyone.
So how does this actually happen? Well, it's not a single switch. It's a series of big moves. First, public hospitals and clinics are going to get more independence, more autonomy. Then, a separate body, a strategic purchaser, will manage the money, buying services from both public and private providers. This frees up the MOH to double down on what it should be doing, crafting smart policy, updating old laws for new challenges, and making sure everyone's voice is heard in the process.
All right, so we've got the architect and we've got the plan. But a blueprint is just paper without the builders. This next part is all about the people who make healthcare happen. The doctors, the nurses, the pharmacists, the therapists, the absolute backbone of the system. And this really just hits the nail on the head. You can have the most brilliant, sophisticated plans in the world, but if your construction crew isn't skilled, supported, and large enough for the job, that building is going to have serious problems. So strengthening the health workforce isn't just a nice-to-have. It's absolutely critical to this entire reform. The strategy to empower these builders is really comprehensive. It starts right at the beginning, with modernizing education so that new grads have the skills for the future. Then it standardizes licensing to guarantee a high level of quality across the board. It also means getting smarter about recruitment, actually forecasting what's needed and where, and maybe most importantly, creating better career paths to keep our talented people, especially in underserved rural areas. And finally, a really interesting idea: creating a new type of community health worker to bring care right into neighborhoods. Now, for the final piece of this foundation, making sure it's future-proof. You just can't build a 21st century health system with 20th century tools. The system has to be smart, it has to be adaptable, and it has to be driven by real data and innovation.
So you hear this term evidence-based a lot. What does it actually mean? Well, it's pretty simple, really. It just means making decisions based on solid data and research, instead of just saying, well, this is how we've always done it. It's about constantly asking, what does the data tell us actually works best, whether we're talking about treating a patient or funding a national program. And that is the ultimate goal, right? The reform is aiming for a system that doesn't just collect mountains of data and let it sit there. The whole point is to actively use it. By encouraging research and baking innovation right into the system's DNA, the plan is to turn all that raw information into real, tangible improvements in health for all of us. And the potential payoffs here are just huge. We're talking about using AI to spot disease outbreaks before they explode, making every single ringgit we spend on healthcare go further, writing policies that we know are going to work, even changing how we pay doctors, rewarding them for keeping people healthy, not just for treating them when they're sick. And as a bonus,
All this focus on data and research could kickstart our own local health industries.
So, after looking at the architects, the builders, and all these smart tools, we have to ask the most important question of all. Why does any of this matter? Why should you or I care about all this behind-the-scenes restructuring?
Well, it's because a stronger foundation means a stronger, more reliable building. All these changes, restructuring the Ministry of Health, empowering the workforce, using data to make smarter decisions, it all comes together to build a health system that's more accountable, that delivers higher quality care, and that gives us all better value for our money. It builds a system that you can truly, deeply trust.
This quote from the health white paper itself just captures the urgency perfectly. This isn't just some technical report, it's a call to action. It's basically saying that the time for small tweaks and patches is over. What's needed now is a massive collective effort from everyone to start this journey of reform and to start it today.
So, as we wrap up this deep dive into the blueprint, the big question still hangs in the air. The plans are ambitious, no doubt. They're detailed, and they tackle problems that have been around for a long, long time. But a blueprint is just the beginning, isn't it? The real test is in the execution, in the long, hard work of building this new foundation, brick by brick. Will it be strong enough for the challenges of tomorrow? Well, that's the question this whole reform is trying to answer.